You know how we do. MC no day here. Play ball in the house.
Sunday, oh, when you MC look on a flavor. Sunday, oh, when you Sunday, oh, when you Sunday, oh,
But also the guitar, the MC look on a beat baby. And I make a no more Niger never. Everybody outside Igbo Yoruba. Make noise anybody on our song. Obviously when I work it because ever for. Because me, I want Johnny. I don't want to see anybody hero they come up here. Make me the flex. If you the vex, you be enemy of progress. Only on a soya soba. Only on the way up to listen up here. Because who want to already go slow from anybody will stop me from making my dough. So come close, kind of bang on it. Every day supposed to be jolly, 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 jolly.
Sunday, oh, Wendy. Sunday, oh, Wendy. Sunday, oh, Wendy. Sunday, oh, Wendy. When I follow Wendy, when Sunday, oh, Wendy. Sunday, oh, Wendy. Sunday, oh, Wendy. If a man and the mother get pulling in, if a man and the mother got still in no. This is one MC love. Yana feel for Nabania. On your way, I will work. I suppose someone piece of wood. On your Nasoya Sawadu. Macanelu, one of Bonelli. What you were in the lay. Who no one in that fish. One net of Kennedy. For the bottom check. Or Kennedy. One net of Kennedy. For the bottom check. Or Kennedy. Sunday, oh, when you I saw when you were Sunday, oh, when you I saw what I was Sunday, oh, when you Sunday, oh, when you Sunday,
I make money for life, no be the hustling. If your time never reach, I'm on both struggling. God talk saying I'm my year with this. All my enemies go bow down for their knees. Okay, give it here when me right now on a song for some women because nobody will stop the shine. Even devil self no say now my time. Who you go blame? Everybody problems so they be the same. People they whenever see food chop, some food they come out from their mouth they drop. Our destiny is they different. You feel the carpenter, others the president. That's why some people they vex. Some they happy say they don't rest.
Sunday, oh, Wendy. Sunday, oh, Wendy. Sunday, oh, Wendy. Sunday, oh, Wendy. I saw the Wendy, Sunday, oh, Wendy. 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 When I saw the Wendy, Sunday, oh, Wendy. Sunday, oh, Wendy. Sunday, oh, Wendy.
So, when I special dedication to Chief Stephen Otita Osadebe. Rest in peace. Inside Records. Now they find your so production.
Wow. This is a really, really nice one. Wow. Hey, family. Family members, I and Dr. Duru had a bet. Dr. Duru looked at Nurse Angel because he is a doctor. He dared me. He told me that his best song is Sunday, oh, Wendy. That if I want to know whether he can dance or not, that he is a man and I'm an ordinary woman, that let us play this song to see the best dancer. I said to him, no be by man, no be by power, nobody dance like Nurse Angel. Family members, can you please tell us between the male Dr. Duru and the female Nurse Angel, who blew this song? Please all vote now. Let us see what the family members are saying. Chai, I wanted to type on Sunday or Wendy. Oh, this one, come on there. Who danced better? Please, who danced? Nurse Angel, Nurse Angel, Nurse Angel. Let's see. Who danced better? Nice one. Who danced better? Nurse Angel. What do you mean happy? Who danced better? Nurse Angel or Dr. Duru? I want to know who danced better. Nurse Angel is the best dancer. Ooh. Yes, doctor. I know you.
It's like you started rigging this dancing competition.
Okay. Dr. Duru said I'm rigging. Can we see other people what they are saying? Abraham said Nurse Angel. Modupe said Nurse Angel. Dan said Nurse Angel. Divine said Nurse Angel.
So this is the introduction.
Yes, we dance in the end anyway.
We set up another competition.
Agree. We dance tire. So, family members, I want to say, let me open my stage. Yes, so, oh, this one I did not put it on. Yes, this is our phone number, but we are not going to do calling tonight. Tonight's topic is prostate cancer. Family. Do you know that prostate cancer is the second killer cancer next to lung cancer? Family, do you know that? Prostate cancer is second killer cancer next to lung cancer among males. Yes. 1 in 7. Yes, 1 in 7 men will develop cancer. However, 1 in 4 black men will also be diagnosed of cancer. Tonight, I want to welcome you and also to introduce you to our wonderful speaker. I am honored to introduce to you Dr. Okechukwu Duru in front of you. Yes, Dr. Okechukwu Duru is a consultant surgeon and a surgical oncologist with expertise in cancer diagnosis, staging, and treatment. Yes. He is also the president and CEO of the Work With Us Cancer Foundation. Dr. Duru, you are here tonight to share your insights, yes, on cancer prevention and treatment. Please, fans, can we welcome Dr. Duru and let him know he's welcome. Let me see what the family members are saying. Woo, woo, woo. They are welcoming. Welcome, Dr. Duru.
Thank you very much, Nurse Angel. Thank you.
Fantastic.
Happy to be here. Good evening, viewers.
Fantastic. So I'm just bringing up their comments. They're saying, welcome, sir. I can see someone at the backstage. He's struggling to come in. So, Dr. Duru, I'm so happy and honored, as I said, to have you amongst us. I will not go into the intricacies of cancer because you, the expert, is here. I will dive quickly, first of all, to ask you to introduce. I know I've introduced you, but what else do you want to say that I did not say well, Dr. Duru?
Yeah. Good evening, viewers. Like she has already said, my name is Okechukwu Duru. I'm a surgeon at Federal Teaching Hospital, Owerri, in Imo State, Nigeria. I'm a surgical oncologist. Also, I'm a board member. Actually, I'm the president and CEO of Work With Us Cancer Foundation, a foundation with the aim of being the #1 organization in the fight against cancer in Nigeria, especially, and in Africa at large. So we intend to work with us. We have the mission of working with all stakeholders in the fight against cancer to bring our vision to success. Actually, I was informed about, I heard about Nurse Angel about, I don't think it's up to 24 hours.
No, it's about roughly, when we spoke, roughly 2 hours ago.
Yes, so we work with every stakeholder in the fight against cancer because cancer is is something or medical issue we talk about fight. It's not something you handle with kiss gloves. So yes, anybody that is interested in partnering with us to bring the message of cancer fight, we will be willing and happy to partner with that person.
Fantastic. Fantastic. Doctor, thank you very much for your wonderful, speech. Doctor, I want to say that, family, I remain your one and only host. Don't mind Dr. Consultant Duru. Yes, I am your host. I want to say that your second speaker will be coming. He will be joining us around 9 o'clock. But before he joins us, because unfortunately, he is tied up in a different event. He will be finishing and joining straight away after his event. Dr. Duru, once again, you're highly welcome to in our Mind Talk show.
Thank you very much, Los Angel.
Honored. We are so honored to have you.
I'm also privileged to be here.
Thank you.
The pleasure is mine.
Doctor, I will not waste time. The family, they are hungry. They are so hungry. This topic about cancer has been requested since last year, but because of our lineup of events, we could not hold to discuss cancer in depthly. So today we decided yesterday to talk about cancer, and we don't want to beat about the bush. We want to go straight into the point. So my first question to you is, what is cancer? What is cancer?
Cancer can be defined as the uncontrolled growth of abnormal cells in the body. Mark the words, uncontrolled growth, abnormal cells. The cells that were normal after a certain time become abnormal, and these cells are the ones now that are undergoing uncontrolled growth. I usually use this example that when somebody or a member of the family, due to whatever, decides not to behave like a member of that family, he doesn't respond to instructions in the family, he doesn't respond to agreements, he starts behaving abnormally. Ab initio, before he became abnormal, he was a member of the family that was agreeing, praying with the family member, doing everything in unison with the family. But that is almost what happens, the scenario that we see in cancer. When these cancer cells become abnormal, they start behaving in a way that does not respond to the normal instructions given out by the body. So they continue to grow and to grow and to grow and to grow. That is basically what cancer is all about. But the cells that are growing were once normal cells that became abnormal. So when they became abnormal, their growth now is no longer controlled. Ordinarily, when we were born, we were small. After some time, we became teenagers, became adults, and grew old. Something tells our body to start growing, start developing bears. For the women, start developing secondary sexual characteristics like the breast pod and even pubic hair. But in the cancer cell do not respond to any instruction by the body. So it continues to grow. And this growth is uncontrolled. You can't control it. And that is why if care is not taken, if measures are not marshaled out to handle it, it may overwhelm the system or the organism or the human being. In this case, the human being is the person we are talking about now.
Fantastic. Fantastic. I'm so happy with the way you simplified your definition, because I had to say to you, these are general public, and
Thank you.
you need to really break it down. We are tired of hearing medical terminology because
I
it
will
will not.
try my best not to use medical jargons.
Thank you. So, sir, I know you likened it to uncontrolled cells growth rather in the body, and also likened it to a family member that is misbehaving, not listening and taking instructions, like when the growth is uncontrolled. Sir, there are a lot of growths in the body, like the cysts, the fibroid, a lot of uncontrolled growth. Can you please differentiate between those uncontrolled growth and cancer, please?
Okay, beautiful. Excellent. Thank you very much, Nosenje. Other growths that will start on their own in the general, our own medical parlance, we call them neoplasms or neoplasia. Some are the benign neoplasms, and other ones are the malignant ones. The malignant ones, another general term for it, are the what? The cancers. There's one thing about the benign cancers. The benign cancers, once you remove it with surgery, and that is the end. That is one behavior. Then another behavior is, okay, let me start with, it grows, it usually has a circumscribed wall. There is a distinct wall when you look at the tumor, from that growth and the body where it's coming from, or part of the body where it's coming from. Like now, when you use the example of fibroids, fibroid grows in the uterus. If you, during the operation for nurses and doctors, they will see that there is a clear wall of demarcation between the fibroid mass and the uterus. That's why we go remove it or shell it out. We use the word shell it out. But in cancer, you will not be able to see a clear line of demarcation. So that is one reason. Two, another reason, it grows and has the ability to leave the primary organ or tissue of origin. What is this primary organ of tissue or tissue of origin? Assuming the primary organ of origin is the breast, it can leave it and go to maybe lungs, maybe bone, maybe liver, maybe the brain. By that time, we say it has metastasized or it has spread to the distant organs. The right or the layman's term is it has spread to the distant organs. Benign growths like fibroid do not behave like that. That's another distinction. It can metastasize. Then when you come to treatment, only removal, you have solved the problem of a benign growth like a fibroid. There's another benign growth that can happen, maybe something like almost every organ, like the breast has a benign growth we call fibroadenoma. The benign growth in the prostate is the one we call BPH, benign prostatic hyperplasia or hypertrophy. So once you shell it out or remove it, you have solved the problem. But in cancer, removing it does not mean you have completely solved the problem. You may, of necessity, mark the word of necessity, it's almost a must that you may need to support that surgical removal with other treatment we call adjuvant treatment. Adjuvant means supportive treatment. That was why I said you support the surgery. What are those supportive treatment? It could be the injections we give through the vein. We call them chemotherapy or cytotoxic drugs. You hear people use the slang chemo. Patient is receiving chemo. So there are drugs that are active against cancer cells. So another one is you may need to support with radiotherapy after performing.
Sir, I think you've jumped. Thank you very much. You've jumped.
Yeah,
We are struggling to catch up with you. So I
yeah.
know you're an expert in this field, but you may need to slow down a bit so
Thank
family
you.
members can understand you. Basically, you have explained different things
Types.
about cancer and why the distinctive, this the specification, or rather the makeup of it, generally speaking. But I wanted also to ask you another question. And there is a very important thing you said. I'm familiar, I hope you heard it. You said that like fibroid and some other good have like a walling around them that you can just go take them out. But in the case of cancer, it is almost joined.
So
Um,
that tissue of origin.
and that is why it's so difficult in some cases as well to control it, like you said. Now, sir, a lot of people want to know, is cancer hereditary? Can it be inherited, as in passed down through the generation?
If the answer is yes, some cancers can be hereditary. Not all cancers are inherited from either any of the parents. Actually, the percentage of cancer that are inherited from parents are relatively small in proportion. You can be talking about less than 10% of cancers are inherited from either of the father or the mother. And that is why when we are discussing with the patient, we ask them about if the father or the mother has suffered any cancer in the family. And what happens for somebody to develop a hereditary type of cancer is usually a genetic defect that somebody can inherit from the father or mother. And when that person inherits that defect, he cannot give it to any of the children, depending on his characteristics. So cancer, some can be inherited, even in those ones there. But the most significant thing, most of the cancer, more than 80%, are what we call new changes or new mutation. They are as a result of new changes in the body, or what we call, the right syntax is new mutation that has occurred in the body. But the answer to the question is yes, some cancers can be inherited. So it's your doctor with other healthcare workers that can guide you on what to do if somebody's mother or somebody's dad had any type of cancer, and you cannot help one to know how to go about whether is it preventing or checking it early. But we'll come to that later.
Thank you very much, sir. And thank you. Um, on that note, if cancer can be inherited, we are Africans. We have a lot of people viewing from all over the globe, most especially African community. If it is hereditary, why is it that most people in our local areas think that cancer is like, oh, a white man disease? Oh, somebody, I have been told, and it's so appalling, I have been told that that cancer can be voodooed on you. Someone will jazz you with cancer, hits you with a cancer illness. What do you have to say about that?
Thank you very much. Actually, these are part of the reasons why we, the board, decided to set up our foundation. What is the main idea of this foundation is to help to disabuse people about what we call myths. Myths are false beliefs about something. It's not the truth about something. They are false notions. What you talked about is it can be projected on somebody either by an enemy, or it could be spiritually controlled. There are a lot of things. You know where we are coming from. You know, we are a country that believes, especially Nigeria is a country that has so much belief in the two religions, two main religions, Christian and Islam. So, and what happens is, if you're not careful, you may run with the wrong information, or we may go home with the wrong information. So part of the things we are doing is to disabuse people's minds about the myths about cancer. It cannot be projected. It is not sexually transmitted. You can't get it by eating on the same plate with anybody that has cancer. You can hug the person. It cannot come to the person. You can even, if it's your spouse, you can meet the way spouses meet, and you will not get that type of cancer.
Fantastic. So since you said something about sexually transmitted, that it cannot be transmitted sexually, I want to say this to you. Is it true? Because a lot of men have been spreading a lot of messages round about to both men and women. Saying, I know we are going to talk about prostate cancer. So, but let's generally still continue to look at cancer. Um, a lot of men have been spreading messages talking about the need for sex, the need for sex. We need to have a lot of sex. A lot of sex is necessary to prevent cancer, especially prostate cancer for men. Women, start giving us sex. Everybody give us sex. Sex will make us not to have prostate cancer. And unfortunately, sir, unfortunately, a lot of people get raped. A lot of children get raped. A lot of women get raped. And if you ask them, they will say they are trying to avoid cancer for men. What do you have to say about that, sir?
It's still under the myth. You know, myth can because it's a myth. It's wrong information. And when people run with wrong information, they can take wrong decisions. Are you getting the? So our own is to let people know some informations about cancer is wrong. Example of a myth like we discussed is the one having frequent sex either reduces the chance or stops somebody from running the risk of developing cancer. I have not seen it documented anywhere in literature. You know what we discuss, we are scientists, we are orthodox medicine practitioners. It's called evidence-based medicine. I've not seen it documented anywhere that it can reduce the risk or obviate the risk of somebody coming down with prostate cancer. That is one. I've not seen it documented anywhere. If anybody has a literature, I will like to. It's part of those myths. This one is even a small myth. When we go to sensitize women in the market, I know you were in Nigeria before you relocated. You know, some women put money. If they don't have a handbag, also they put it inside their bra. And when you ask, we decided to inquire from women, what do they think causes breast cancer? Some of them said their option was putting money inside the bra, and we told them it is not part of it. Others answered is when somebody has multiple sexual partners. We told them for the breast, it has nothing to do with that. But there is another cancer that multiple sexual partners can lead to, which is cervical cancer. That's it. So in every area there is wrong information. It is not only in medicine, it is there. But why it is not too good for us in medicine is it can make our people delay in presenting to us. And when they come, because of those delays, they come at a very late stage that we may not be able to offer cure or curative treatment. We may be able to offer only palliative treatment to the patients. They will still spend a huge amount of money, but the results will still not be good. They will not have a beautiful result or wonderful result from the care we are able to offer because they believe the myths. You will see some people will drink anything that comes to their mind. They will drink supplement this, supplement that. Are you getting the point? So those are the things. And a lot of things are contributing to these myths. Not having enough human resources, not having enough support service for the human resource, not having enough equipments or the human resource in the hinterlands areas. It's not everybody that's staying in the cities or the cosmopolitan areas where you have enough doctors, physicians, nurses, and pharmacists that can help guide patients. There are some people that live in the villages. So those areas are not properly manned. If there are not enough human resources, your guess is as good as mine that the people that are not qualified will be giving medical information. And this medical information, when these people take it, they can take wrong decisions. That's what happens. There is a lot of it's not only in cancer. There's some religion that believe that when they are sick, when they sleep with young girls, they'll be cured of their sickness. So those are the things. It's not only in cancer, but why the health own. One significant thing about cancer is cancer will not wait for you to finish wasting time or making wrong decisions before you present. It will be carrying out, growing, and be not responding to it. So that if you don't seek medical attention early enough, it may make you to be seeking medical attention when it is almost late or very, very late for the physicians to do something significant for you.
Stop there. You are going to continue. Wonderful. Now, I want to showcase this. This is Chinweze Onuko. Chinweze Onuko is my dad's youngest brother from his mother's side. My granddad is married to two wives, and the first wife, he is the last of the first wife, which is my dad's youngest brother from his mother's side. Chinweze Onuko had prostate cancer. Chinweze Onuko, my uncle that I love so much because to my dad, let me come up, I'll bring you later. To my dad, Chinweze Onuko is his first son. To my dad, Chinweze Onuko, you can see on the screen, what is his first son? And he treated him as such because my dad trained him from childhood. And when he got married, he still lived with us. And he had his first daughter, second child, which was a boy. But Chinweze was the first child of my dad as long as he's concerned. Chinweze developed cancer. I and my dad were here. I brought my dad here 2019. And we got a call that Chinweze is sick. He's not very well. So I called, my daddy does not joke with him. So before my daddy had the information, I said, don't tell him yet. My dad doesn't joke with him. My dad loves him more than he loves us. That is how bad it is. So I called and spoke to Chinweze, my dad's youngest brother. Chinweze, what is it? Oh, this and that. Go to hospital, gave him everything. He was reluctant, but I kept pushing and pushing because I don't want, my daddy was just arriving UK when he started having this illness. I don't want us to start going back to Nigeria, just him coming in September or August, then we got a call around that October, November that he's very, very sick. So go to hospital. We were pumping money, because he has to be alive for my daddy to be alive. That is how bad it is. My daddy really loved him. Pumping money. Then I said he had cancer from the diagnosis, that he had cancer. No, Chinweze did not agree. It's his enemy is sick and all those stuff. We have faith, your enemy is somebody. They were going native. Then when I was crying, begging, calling, the thing, before the symptoms comes out, it has already started killing you. So by the time Chumweze agreed to anything, it was when he was already dying. I want to bring him up again to show family members. So this is Chumweze, my dad's beloved, and I love him so much. He had prostate cancer. So that's my dad, the person, the one on the blue jean up and down. This was in 2019, verse 2020. And this is me, the lady with her hair like that. So we went to see Chumweze in the hospital because we had to go. You know, what I was trying to prevent, we had to go. He had prostate cancer. And this is me feeding my beloved uncle Chumweze in the hospital because he was really, really sick. Yeah. So you talked about delay. It is so rampant that people delay to get treatment in Nigeria. My uncle visited traditional medicine, this herb, that herb, this drink and that drink. He went to native doctors. He went everywhere before agreeing to go to the hospital. By the time he went, he was already urinating blood and everything. They carried him like a child, with oxygen everywhere to the hospital. And there was no amount of money required that in fact, we gave them money in advance, get him alive. So we prepared to bring him abroad for treatment. But Chumweze, unfortunately, was not well enough to come to UK. He could not. He was not well enough to come to UK for treatment, and he died. He died in 2020. Doctor, what can you reiterate what people need to do to not die in the hands of cancer? You are muted, sir. You are muted. You are muted, sir.
Thank you. Thank you very much. Like you said, is to reiterate, reinforce, re-educate, and continue to educate, continue to advocate, continue to inform. There is nothing, you can't force any adult or tell him it is his right. Wherever he wants to go is where he will go. You can't force him. So when you look at the background of relatively poor education, there are a lot of challenges that we feel are the cause of all these reasons for this delay. One, poverty. He may not have the money to go to the hospital. The money to transport himself to a hospital where he can get the right service may not be there. At least you agreed. You people were the ones bringing the money from outside for him to come for treatment. So poverty is one. Education, understanding that health is wealth. That is only when you are healthy you can pursue other engagements, you can make money, take care of your family, love your family, even be alive for the society. You need to understand that cancer will not cross leg and allow you to make all the mistakes, taking wrong decisions before you present to the hospital. You will not. Another one is about the myths. There are some people that circulate information that once you cut on cancer, that's once you do operation, it will spread. That is a myth. Thank God you are in UK or London. There are, for what we call solid organ tumors, most of them, part of treatment is operation to remove it, or a very good aspect of proportion. If you can remove it completely, go ahead and remove it. But if you can't remove it completely, assuming it is attached to vital structures, you remove it as much as possible, then support your care with other supportive care like chemotherapy, radiotherapy, and the other ones we call targeted therapy. So we can't overemphasize the importance of re-education, information dissemination, right information dissemination. Right information is the most important thing. What are those right information? Cancer is not a death sentence. Cancer is treatable when the patient presents early. Early diagnosis and treatment leads to cure. When you get it early and treat it, the person can be cured. Screening is a cost-effective way of picking up cancer very early. I have some professors, lettered people that you say go for check whether you saw any type of cancer. Like if it's women, say cervical cancer, go and do pap smear. If it's men, they say prostate cancer, go and do PSA. They are not ready. Some will tell you, oh, what if you find it? What will I do? I said, is it not better? It's like when you are traveling, you check your car if the tires are less or good. So if it is less, you add air. Is it not better you check? So even people that are supposedly knowledgeable still believe the myth. So these are some of the issues. It's not one, it's not two, it's not three. Poverty is the education, myths about it, and some stubbornness, even some religious beliefs also, that there's something they say, not my portion. Not my portion. Then there's another slang they do work. They say what God cannot say, what God cannot do does not exist. So these are some examples of those religious beliefs. It's true, God can perform miracles, but God is God. He decides who to be. I'm a Christian. I believe God. It's not trying to push down what
So
God can do.
before you start giving excuses for people and their belief, I want to say that it's God that created the doctors that also discover the illness. So what God cannot do does not exist. Yes, go to the hospital. Because those
Good.
people that go to the church to see what God does not do, does not. Honestly, the pastor, your pastor, when he is diagnosed or when he wants to go for ordinary check, he comes to UK, he goes to America. Then you go to his church for him that goes to proper hospital to get treated, to pray for you. So, Madeleine, a wonderful family member of the page, said that she remembered what cancer did to the friend of her father's friend's wife, and how they did everything with money. And they had money because you talked about poverty, yet the person died. I know that, like you said, my uncle, Chuenze, is the first son. In fact, he brags about my dad, and anything he wants, he also gets. Is more of the illiteracy or education or lack of awareness, as well as you rightly stated. Just to answer Madeline, but that's by the way. There are a lot of issues as well that has to do with poverty. I agree. Cancer, you already have answered the question posed by family member Nanshag, Idowu, and Oluwumi, and they were all asking, can cancer be cured? You talked about early diagnosis. Is there any other thing you want? Because I agree with you 100%. I always talk to family members and say, early detection matters. No matter what it is, the earlier you detect it, the better chances of the cure. So, apart from early detection, which is absolutely amazing, and the test, because once in a while we do a campaign for tests, we ask family members to go and undertake certain tests. Can you talk more about if cancer can be cured apart from the early detection? So,
Thank you very much. Like when we started this discussion, we told us that cancer cells were normal cells that became abnormal. So for you to make this early diagnosis, the best way is for people to observe those screening modalities and screening advices. Like for men, they should go for PSA at 40. For women, PSA means prostate specific antigen. It's a check, blood check to know if somebody prostate has started developing what looks like cancer. That is, it does not confirm cancer, but it will tell people to say, yes, you will now do further tests. The test to be sure of prostate cancer is through cord biopsy or core needle biopsy. The simple English or syntax is to take a piece of that prostate and send it for histology to be sure that there is cancer cell there. That's one. For the breast, we do what we call mammogram or mammography. It's a type of low dose X-ray that is used to check the breast. And we encourage women to do it by 40. Anybody, whether you have any symptom, pain or not, once you get to 40, do your mammographic examination. Assuming the person has pain, lump or discharge, make it or not make, whatever type of, and you are less than 40, we can use what we call breast ultrasound. The normal ultrasound that you use in checking a pregnant woman, that's what we use on the breast. That's for it. Then for the cervical cancer, we perform what we call pap smear, PAP, but the full meaning is Papa Nicholas smear. You don't need to know the jargon. Just go for pap. The pap, like they pronounce pap of pap that we can eat from maize. So pap smear. Once you go, your doctors, your healthcare professionals will guide you where you can access these services. For other common cancers like bowel cancer, that is cancer of the intestine, we can do what we call colonoscopy. You use the type of camera on a tube and look inside the intestine to check if there are features that show early changes that can lead to cancer. Those are the things we can do. We do it for the relatively common cancers. Then, if another way of picking up cancer early is any symptom you have in the body, please don't stay to interpret that symptom on your own. You don't have the requisite training to interpret the symptom. You are not trained. You are not a doctor. You are not a nurse. You are not a healthcare worker. That is why don't interpret it. Don't assume you know what is happening. You don't have the training. That is one. Two, don't ask an uninformed person to interpret your symptoms for you. Like now, you ask your classmate, you ask your neighbor in the house, or you ask your roommate, you ask your colleague in the office, what is happening to me? Example, I am having difficulty passing urine. I'm passing stool with difficulty. What could it be? He will tell you it is jadi. It's not jadi. Please, for women, if you have lump in the breast, you ask your mother-in-law or mother or sister or this, what is happening? Please don't try to interpret symptoms or ask an uninformed person, an untrained person to interpret your symptoms. We say in Igbo language, which means move as fast as your health can carry you and get yourself to the hospital. Let the doctors ask about those symptoms, examine you, and request for tests that can help them make the diagnosis. Once we're able to make the diagnosis and we're able to stage it, it is important the sickness is properly staged. We can now inform you of the diagnosis, the stage, and tell you the chance of curing it or not. For us, like I said before, early ones, stage 1 and stage 2, they are curable in most cancers. Stage 1 and stage 2 are regarded as early cancer in most common cancers, and they are curable with the combination of treatment modalities.
Thank you very much, sir. Thank you very much. And at this stage, I want to say that a family member, Jane Ike, Gawain, and Elizabeth Sati, they want to know. You've talked about the whether it's curable, how where to go to, the test, how to then how to check early detection and other things. What causes cancer? They want to know.
Thank you very much. Few cancers are the ones we scientifically know their direct causes or near direct causes or very what we call risk factors, high risk factors. Few of them that we have been able to say for sure this is the cause of so and so. Some others and most of them we talk about the risk factors. For the ones we have a cause or we have known the cause, one of them is skin cancer. For people that are Caucasians, people that also have some deficiencies in their skin. Example are people we say people living with albinism. They have a high tendency to suffer skin cancer, and their own cause of skin cancer is the effect of ultraviolet rays on their skin because they have reduced content of melanin. Melanin is what makes our skin dark. This dark skin is protective. For those people that have low melanin or no melanin, for the people living with albinism, they have a high risk. So the ultraviolet rays are the ones that cause the cancer in those people. So how do we prevent it? If we know the causes, to encourage those people to wear what? Long sleeve shirts and not to expose their bodies to the direct rays of the sun. That is one. Another one is cervical cancer. Cervical cancer is caused as a result of a virus, and that virus is known as human papilloma virus. Actually, this virus is gotten from sexual intercourse. But most women with good immunity, because most women have good immunity, they will clear these viruses when they are exposed. But if the ladies or woman's cervix has not developed the right skin or epithelium, the skin on the cervix, we call the epithelium of this, if it is not the mature type, especially. So for the people that got exposed sexually at a tender, they have a higher risk of coming down with that. So, but we know that it is this human papilloma virus that changes the constituency or architecture or genetic makeup of the cervical skin cells, that skin of the cervix or epithelium. Right word is epithelium, but I'm using the word skin to pass the message. The skin that covers the cervix. The cervix is known as the womb, the neck of the womb. Neck of the womb. The womb is the uterus. The neck is the cervix. For women, when they wash their bodies, that place you're able to feel is the cervix. So cancer occurs there and is known to be as a result of human papilloma virus infection. There are a lot of types. We call them serotypes. But the most important thing is if we administer human papilloma virus vaccine to these ladies and even the boys when they are in their teenage age group, it gives almost more than 90% protection from the woman coming down from cervical cancer. That is for the ones that we know their causes. So then for something like liver cancer or some types of liver cancer, it's as a result of hepatitis infection. Another one is chronic alcohol abuse can give liver cirrhosis and now lead to hepatoma. These are the ones. Apart from this, plus some others I may not be able to remember, but these are the common ones. Other cancers, as we regard them as risk factors. What are the risk factors? For the other ones, we talk about sedentary lifestyle, not exercising well. For women, we say not breastfeeding our babies by our mothers and our wives can lead to increased risk of breast cancer and or not getting pregnant early enough, or getting pregnant at a late stage in life increases the what? Risk of breast cancer. These are some of the risk factors. Then another thing that is important for everybody, anybody who has suffered breast cancer has a higher risk of suffering breast cancer on the other breast. So that person now has more duty, more responsibility to be visiting the hospital and meeting her doctor to discuss and get that other remaining breast examined after she has been treated on the other breast. Thank you.
Thank you very much. Thank you very much. I am so thrilled. I am so thrilled to introduce to you our second speaker. He is here already. His name is Dr. Jonathan Newell. Yes, Dr. Jonathan Newell is a renowned consultant urologist. And yes, he is a robotic prostate surgeon here in the UK. Dr. Jonathan is a proponent of the robotics. Yes, you know, we are always talking about robots are coming, robots are coming. Yes, robots are coming, and he is a proponent of using robotics to interface with the prostate surgery. Dr. Jonathan has made a global impact in prostate care, and he is here tonight to share his expertise on prostate cancer specifically. Yes, we told you that he will be joining us at 8 p.m., which is 9 p.m. Nigerian time, and he is here. Dr. Jonathan, show your face. Yes! He's still driving! Oh. Yes, he said he was tied up in a previous event, the same talk about prostate cancer. Dr. Jonathan goes around the world. He's well known in US and here in UK, talking about prostate cancer and how to improve and make the treatments very easy and free from pain. I think he may want to join later. I see you're still driving. You can say hello to family members, then maybe later when you're relaxed. Take your time. We will be here waiting for you. Tonight is the night. We will not go anywhere. We will extend it because
that's very kind. Thank you very much for the invitation. I will be home in 19 minutes, so then I can join properly.
Fantastic. That we'll die here. We die here. As long as you're coming, we will extend the time. That's fine. Thank you.
Perfect.
Sir.
I'll see you then properly then.
Thank you. Okay. So we'll continue, sir. I just wanted to welcome our second speaker. Okay, now, another family, thank you, Dr. Duru, for, you see, one thing with us is that it's very important for us to touch base. I like touching base in whatever I'm doing. So, a family member, Nara, has asked, can cancer be prevented, not cured now? Can it be prevented? And can you tell us, I know you've been talking a lot at what you do, how to prevent, but tell us specifically, if yes, what do we need to do to prevent cancer? Please, we want to know. Sorry, sir, let me unmute you. Yeah.
The answer is yes.
Ooh.
But it is not every cancer that can be prevented. It's those ones that can be prevented that are preventable. Example is the cervical cancer. One can prevent it by receiving human papilloma virus vaccination, the way we receive other pediatric immunization or vaccinations. We are lucky the HPV vaccine now is part of our routine immunization for Nigeria. So we are lucky Ministry of Health has given us that. So we've done the pilot, and it's about in 6 days or so. I'm not sure, but they will continue expanding it and expand so that it gets to the 36 states of Nigeria. So those ones can be prevented. Then for the ones that are like lifestyle, if you change the lifestyle, you can also prevent them. Like, what do I mean by lifestyle? For the people living with albinism, if they don't go out, if they go out with long sleeves, shirts, even gloves, and wear something like face cap or so, what the essence is to reduce exposure of the sunlight, because we are living in the tropics. One thing about tropics is the sunlight is out more than 12 hours in the day, and is high. And for people who don't have that melanin, it can damage some things and lead to the possession of cancer. That is one. So then for people who do smoke, smoking causes a lot of cancers. Cancer of the lips, cancer of the tongue, cancer of the throat, cancer of the lungs. If one stops smoking, or if one does not start smoking at all, he has a high chance of not coming down with lung cancer. Very, very high chance. Unless you stay with people that smoke, then you can be a secondary smoker. But not starting. Then if somebody stops smoking, after maybe up to 5 to 10 years, the person's risk reduces to the person who never started at all. But what we discuss cancer is with relation to the risk of coming down. That is the need for what? Screening. You hear about 1 in 9 blacks, 1 in 7 blacks will come down with so and so cancer. Because of that, everybody should be screening to pick it early and now get it treated. These are for the ones that are preventable. Then if somebody has a genetic abnormality that can predispose to cancer, the person can do something. There's one celebrity, you know her, all these people will also know her. You know the person I'm talking about, Angelina Jolie.
Okay.
She had double mastectomy. Mastectomy is complete removal of the breast because she had a genetic makeup. We call it breast cancer gene abnormality. And if somebody gets that gene abnormality, he or she has a high risk of coming down with cancer. We had one of recent we treated here in Oure. The mother and 2 daughters suffered cancer. So if somebody has that genetic abnormality, he can just come for removal of the breast, because cancer occurs on the cells that make the breast perform its function, which means the ductal epithelial cell. The ductal epithelial cells secrete the milk, or it is through there that the milk gets to go to the nipple for giving the baby. So it says it's not every type of tissue that has that. So it says, so what that celebrity did was to remove the 2 breasts, and her chance of coming down with breast cancer has reduced almost to that of a normal person, or non-existent now. So these are for the ones that are what? Preventable. Because we know what causes them. When you know what causes something, you can prevent it. But for the ones we don't know, we discuss as risk factors. What we do is to have very high health, or what we encourage is high health seeking behavior. Meet your doctor when you notice anything that is wrong in your body. This is your body. You already know how it works. They say the patient is the best physician, the best doctor. You know your body. This is the body you have been living with. And if anything is wrong, please don't try to interpret that symptom. Go and discuss it with your doctor. So it's after the discussion now. So for those ones that are not preventable, you can now have a high health. So if you notice it go, the doctor will see you, martial out tests that can help pick it up early. That is where we talk about early detection. Thank
Okay.
you.
So I know you've talked about types of cancer. You have mentioned it, so no need to go into it. This is Omario, a family member wanted to know. Another family member, Oboefule, they're asking, how does cancer develop? You've talked about it when you were defining cancer, but specifically, can you focus specifically to say how it develops in the body? You're muted. You're muted.
Thank you. Thank you very much, ma. There are most cancers are acquired. Very few cancers occur in utero or as a congenital abnormality. There are some sicknesses that are congenital abnormality. Example, somebody, if you give birth to a child and he has a hole in the heart, it is a congenital abnormality. It's something that happened when the baby was inside the mother's womb. But most cancers are as a result of living in this world, in Mother Earth. But some of the things that can lead to it may have happened when the person was inside the mother's womb. Some may say happen outside. I gave an example of smoking. It's an acquired thing. There's no baby that smokes. So adults or teenagers start smoking. The one that is human papilloma virus infection for the cervix also acquired. When the person starts or commences sexual intercourse. But there's something when these insults occur on the cell, we use the word insult. When they occur on the cell, most times the changes they cause to happen in the cells can be repaired. It's at the cellular level. I may have difficulty, but I will try and say. So some may be repaired, but some may miss being repaired. It's like when you're using a filter to sieve something, some impurity may pass through. That impurity may enter the place you don't want it to enter. So that, assuming it is a cancer cell, it can pass that clearance and now stay in that part of the body and start, because it has become abnormal. It is like I use the word impurity. Ordinarily, the body should pick it, clear it, or repair it. Either it will mop it out and kill it, or it will repair it and make that abnormality to become normal again. It is at the cellular level. But if he misses that place, it's supposed to be repaired by the body mechanism. Because those insults we are getting are happening, like we that live in tropical Nigeria. Sunlight is still hitting our skin. But those changes, when they occur, our body will repair those things that can happen. So sometimes we stay with people that smoke. Personally, I don't smoke, so I can be called a secondary smoker. If it can cause a change in my body will repair it. And it will not show. But assuming that cell misses being picked up and repaired, it can land in that prototype cell or tissue of origin or organ of origin and stay there because it's now abnormal. Something has happened to it. It is no longer a normal cell. Example I use is somebody that becomes a schizophrenic or in our balance here, mad. He does not respect his father again. Before, his father will say, come and sit down. He say, yes, sir. But now if he becomes that, he won't answer his father. He can start to remove his clothes. It's now abnormal. It doesn't behave like a normal cell. So that cell that has started behaving abnormal will continue to still grow. The blood comes to it, so it will take the blood. It can multiply, but it multiplies and gives rise to or birth to abnormal cells. So with time, the cell will become bigger, bigger, bigger. And if it's a solid organ tissue like the breast, you will see it will be the size of a granite. Small time, you lose the size of a table tennis ball. The next is size of an egg. It may occupy the whole breast. That's how it continues to grow. So that's the main thing. When it becomes abnormal, it will now continue to grow without responding to the normal instruction in the body, because there are always normal instruction the body gives out to every cell.
Sir,
Thank you.
sir, you've always, tonight we are going to focus more on prostate, but we are still, touching on every other cancer. And mostly you're always talking about the breast. The breast. You've talked about other places, but I like that. You also gave an instance when someone had to cut the breast to prevent the growth of cancer because of how it's developed. So myself, as a young girl in secondary school, I remember when I was watching a program and they were talking about cancer, and they said if you want to check breast cancer, they were talking about breast cancer. If you want to check whether you have breast cancer, touch, touch and feel for lumps. Yeah, and I'm like, what? They say go to the mirror, do like this. I went, I went. I was in secondary school and I do that. I said, there's a lump. Oh, mommy, I have a lump in my breast. I have cancer. They say if you want to feel, you should touch and feel for lump. Mommy, look at this. My mom was like, cancer? What do you mean you have cancer? I said, mommy, I heard it. Let's go to the hospital. I have cancer. So they are like, she wanted to see. I showed her. She said, I don't think. I said, mommy, I have cancer. Then we now went to the hospital because I insisted. We now went to the hospital. When they checked, they said, wow, she has a lump in her breast. I say, it's cancer. They say lump in the breast is how to check for cancer, breast cancer. So the doctor, they examined, I was a young girl in secondary school. And they examined me, and they said they must take it out. Yeah. So they did surgery on my breast. Is this breast? I was in secondary school. Is this breast? They said they'll do surgery on my breast, and they did, and they removed a growth. Yeah. And they removed a growth. Then they said to me, it's 99. Yeah. Growth, so to say. Then you've talked about breast, this and that. Can you explain to the family members the difference between a benign cancer and the other one you talked about? Tell us number one, the importance to do tests for each kind of cancer or to test for prevention, and also growths in the body, because I also had to do surgery in my stomach. Again, another growth. Now, the question is, because they removed a cyst from my stomach, and the cyst, they say, was so big. They said, I asked them, how long have this been in me? They said they don't know, but it may be as long as 7 years ago. And they said it's non-cancerous. My question now is, can a non-benign cancer become cancerous? You are muted, sir.
Thank you very much. When I was making the introduction, I said you asked for this distinction, how to differentiate between benign and malignant. I said the benign is the non-cancer. Malignant is the cancer. And I tried to say it has a specific wall. You can see the distinct wall between the tumor and the tissue. So for almost every part of the body, anywhere it occurs, the benign cell will be well walled out. We call it well circumscribed, but walled out from the tissue of organ of origin. Unlike the cancer, it will be difficult to say the line of demarcation. So it grows into the normal tissue. That is one. Two, cancer can also grow and leave the organ of origin and spread to distant organs. But benign cells or benign tumors do not do that. The way to be very, very sure is when you remove it, send it for histology or special type of test, or send it to the lab. That's all. So that the lay people will understand once you remove it, even if your doctor tells you there is no need to worry, tell him, please, I learned that it should be sent to the lab. Send it to the lab. It is that lab that is the final arbiter, is the final judge that will say it is cancer, it is not cancer. From there, we can make more decisions.
The question again, thank you for that. Secondly, I know there is difference, yeah? Can one lead to the other? I know it's a silly question, but it's important for me.
It is not a silly question. It's not a silly question. Some benign tumors can undergo what we call malignant transformation or malignant change or change to cancer, but it is rare. Occasionally, it can. Most cancers start as cancers from the word go. Most non-cancer tumors or most non-cancer lumps start as non-cancers from the word go. But like they tell us, never say never in medicine.
I
Some
know,
things can
I
so
know. So,
some benign ones can turn and change and become cancer. So how do you know? I said it before. That is where you should be hammering, and that's what I hammer when I talk to people. Don't interpret your symptoms. Just like you were a teenager, you were interpreting your symptoms. Are you getting the point? Luckily, because that interpreting your symptoms, because you went and listened to the radio or television, you were not a nurse, then you were already in secondary school. So your knowledge was limited, but you did the right thing. Go to the hospital. Doctors examined you, removed the lump, sent it for histology. It came out benign. Your nothing was done again. Nobody said they must remove your breast. Are you getting the point? So it is that standard way of following medical care that we need to work hard and encourage our listeners to do. There's already one standard way. Follow your doctor's advice. Let your doctor advise. Assuming you feel your doctor does not have the capacity to advise you, when you have a right, go to another doctor. But don't go to a herbalist or don't go to prayer warrior. Just
fantastic.
follow your doctors. You have a right to go for doctor in maybe, let me use Imo State, my state, or Nigeria. Another one doctor, if he tells you something you don't like, you can go to our capital, which is Abuja. If they tell you what you don't like, you can go to Lagos, which is a business city. But you must get a doctor that will handle you and tell you what you want. Then if you have the resources, you can travel out, but don't go back, because going to your religious leader, your prayer warrior, or the herbalist, you may harm yourself. You may, and we don't want you to harm yourself. That's why we are making out this time to bring it down to the level of everybody to understand, so that you will say you are properly informed. Even if it is your sister, brother that did the operation, you can stay here and ask, did they send what they removed to the lab? You can ask the question. They say they didn't say, you can say no, send it to the lab. If you don't get money to go to the lab, look at the money for it. Let them find out and send it. That's what I want. Because you have been informed. You cannot be sure of the type of tumor or the type of lump or the type of disease or the type of sickness until you send that thing removed to the lab. Thank you.
Fantastic. So, sir, I know you made mention, and thank you very much, the importance of asking for the growth and taking off your body to be sent to the lab. Very important. Because, like you said, I, as a child, I already said I had cancer because I felt it. I felt it. This is hard. They say it will be hard. But this is different from my breast. And I was lucky. I insisted. And because from childhood, I don't believe in all this native doctor, juju, all those stuff. No. So you said go to the doctor and get them to insist they do that. I like that thing you said. because I know a lot of people that have had cancer that was missed severally, even when they went to the doctor. They were checked and they saw growths, like they saw my growth, and they said, it is this or it is that, it's nothing, don't bother. Yeah, go. And it's several tests and insistence that they discovered, wow, this is actually it. Especially when they did more in-depth check or test. Before I ask the question, I want to say that again, Nurse Angel, I had a growth in my stomach, as I said, apart from the breast. And I went to the hospital. I was told it's nothing. I went home. I went again to the hospital shouting, my stomach, oh," because I had pain in my stomach, serious pain. And they checked me, they said it's poo. I had a lot of poo. And they gave me something to take, and I went. I went again to the hospital. Please, you guys should do a test, because I like to insist. I say, do a test. This thing, I don't like it. They didn't agree to do much of the test. And the other time I had to call 999 because my husband, I was shouting, my stomach, my stomach. He said, this girl, I'm seeking for attention. I was, because of the comment he made, I now called 999. And they took me straight to A&E. And pam, they checked. And they said to me again, go home. But before I left, I insisted, I'm dying. They did tests. And after 2 weeks, I was called. They say, come. There is something not poo. Because they told me again, there is, I don't know what they said, but I can't remember what they said. But the first time they said I had poo, they gave me something for constipation and all those stuff. So they said, come after 2 weeks. It's not here in UK anyway. Come after 2 weeks. And I went. They said, you have a big growth in your stomach. And that was the one they now brought out. And again, thank God, it's non-binary. And sir, I have done another surgery for another growth, but this time around, it's fibroid. The issue now, sir, is that even the people don't trust doctors any longer because one, they see people go and they say nothing is wrong with you. And when they go to the native doctor, they will tell them this person is killing you. And they trust the native doctor because they're giving them an answer to what is pain. I know something. I know something is in my stomach. I felt it. But I was told nothing until the third time I was invited. What do you have to say about, number one, the fact that sometimes our doctors honestly do fail us? Let's be honest. And we now rely more on, you're muted on traditional.
I didn't get what you said, that our doctors are what?
Our doctors sometimes do fail us.
I like that.
Yeah.
You know why I like it? You know why I like it?
Yeah.
You know why?
Yeah.
You are talking from a place, please don't take offense,
That's
of
right.
not having enough information. That's where you are talking from. I've had, you called me within less than 2-3 hours.
Correct.
Are you getting the point?
Yeah.
I had to clear my table to make sure I participate in this. And I told you my idea, my belief is to do my best to continue to educate people wherever, whenever I have the capacity. That's our mission. That's one.
Yeah.
We do not have enough manpower. You have not factored that in because we don't have enough manpower that are serving our population. Madam, please sit back. Because it's because of this thing you said. Sit back, find out how many doctors in Nigeria and the patient load, and find out how many doctors are of Nigerian descent that are practicing in the UK and US. Nigerian doctors are still living in droves. So the thing they do, I'm not making an excuse for a doctor that decides to allay the fears of a patient, without thorough check to be sure. I'm just helping you. I just want to clear this your notion that doctors do fail us. Yeah, it may happen because assuming the doctor is overwhelmed. People, Nigerians, I have been practicing medicine in Nigeria for more than 20 years. Nigerian patients do not want to follow medicine the way it's practiced. They want to believe they know more than you. That's why they go and drink supplements. That's why they go to chemists and buy drugs and keep on. Their first way to go is to go to chemists after they go to lab and do tests and buy drug. By the time they are coming to you, they have wasted time. These are the issues. We're not talking about the illiteracy. We're not talking about the fact that there is no, that the, what's it called? Health insurance is not that accommodating a lot of people, because it's not easy for somebody to bring out money from his pocket and pay. That was why I said you are talking from where what? Not having enough information. If you have enough information, you will know that this just good. And please, I want to educate us, all of us. You will say that. Second thing, doctors are meant to reassure. That's their job. They shouldn't heighten your fear. You personally, we are thinking you had cancer as a teenager. If you had cancer, you would have died by now. You didn't have cancer. First thing, the doctor examined you. Second, they said, let me remove it. And now, removal, sent it for histology. It came out benign. He reassured you it is benign. There is nothing to worry about. Focus on your education. True of us.
Fantastic.
That's what you did. That's it. So he reassured you. If you had heightened your fear and told your mother and said you will die tomorrow, I will cut off this girl's breast, they would have listened to him, true of us, because he said doctor, but he never did. He reassured you and reassured your family. That is what doctors are trained to do.
So,
Just cool down. I want to analyze this for you to understand. Because of all these many problems, the tendency that they may start reassuring without having a thorough check, because the population they are serving is too many. And we want you, where are you from? When do you come to Nigeria?
I'm from Anambra
Yes.
State. My mom
Good.
is
Please,
yeah.
if you
Nigeria yearly.
yeah, beautiful. If you come to Nigeria, I work in FMC Owerri. I will like you to come to my clinic in FMC Owerri or Federal Teaching Hospital Owerri. You, please come. Cross your leg and observe. Don't let them know you're a nurse. You will come and shake us here that people are trying. Are you getting the point? Because the population is pushing. The population is coming for the limited manpower. We have doctors you finish training, the next thing they enter Saudi Arabia, the next thing they are in UK, the next thing they are in US, the next thing they are in Canada. These are the way you should be seeing it, not to look at it from straight-jacketed way. No, ma, you are at a vantage position now. Are you getting the point? You can use this to talk to the government. In our own Imo State, there was a governor that almost started building 27 local governments, 27 general hospitals in Imo State here. Up till now, you can't go and access any care from any of those general hospitals in the 22 local governments. And the other general hospitals that were in the system, we are asked to stop. Hello. So you don't just look at things from superficial. I don't want to say I'm pained, but I sincerely am pained that you did not really understand. Where you are practicing, you trained as a nurse in Nigeria or outside? Here. UK. Beautiful. Please come and just use 1 week, 2 weeks to go to any of those hospitals in Anambra, your home state or Imo State. Maybe your husband is from Imo State or your mom is from Imo State.
I say my mom.
Beautiful. Come. Even one wine. You understand?
So
you come.
Thank you very much. So quickly, I want to say this. I hear you and I feel you. I honestly do feel you and I understand. Dr. Jonathan, just 1 minute. Dr. Duru, I will never ever come on, even as I'm a new nurse, but before I became a nurse, I honestly feel bad for doctors in Nigeria. You talked about the population. You talked about the migration of doctors leaving Nigeria. Yes, you talked about the facilities. Absolutely. Who does not know about that? In fact, it is appalling that the president of Nigeria, the government officials, the rich people in Nigeria, rather travel abroad to come for very good treatment than build their medical system in Nigeria. That is no brainer. Everybody's against it, including everybody, including yourself and myself. We are not happy that Nigerian government rather lavish money on wardrobe allowance, jets, and what have you. In fact, it is appalling that the country, the rich people in the country, use the money to build churches upon churches, every street and village. In fact, houses, each house in Nigeria have a church. And we yet, like you said, we can't boast of one very good hospital with good facility. Nonetheless, sir, I've been to Nigeria. I go to Nigeria. We were in Nigeria when my uncle died of cancer. I can say this to you. Some doctors, we say to you, pray. Pray. I know. If you look at factors, as you said, they don't have the wherewithal to treat the patient. And that is in itself not enabling factor for them to do a proper diagnosis and treatment. Absolutely. However, I can say this to you. In fact, one of the admin of the page, the mom is always suffering from seizures. And I was screaming, take her to a specialist. You will see they always go to clinics, hospital clinics, and private clinics. That these doctors don't have the enough equipment. Yes, due to a whole lot of facility factors. Yes. However, sometimes they just keep you there. They are keeping you there. I've seen doctors, when I went to Nigeria, they said to me, pray. I was annoyed. I was offended. Why do you, medical doctor, you're telling me to pray? What can you tell me what is wrong? What do you mean by pray? I'm not against doctors, but I am worried sometimes. Trust me, sometimes when you hear a professional doctor say to you to pray and not honestly having facilities, which why would you say?
Let me come there, even though I want you to understand it, and I will use an example you can relate with. In every 12, there is a Judas.
That is it. Thank you very much,
In
sir.
the place you practice, in the place you practice, there are a lot of unethical doctors there in UK, US, in Canada. Yes, but the system, could and please, and understand, the system is so high that it is screening people and making sure that they practice in an ethical manner.
Fantastic.
The system is not high here. So I keep on telling you, when this type of things come up, like now, you should have interrogated the person and asked, are you a well-trained doctor? Ask him that question, because
History, yes.
that's
Correct.
what you should ask. Because if you're a doctor, you should tell me what is wrong. I have been praying before. I didn't come here to pray. I came for you to make the diagnosis and treat me. See, there are some things you will see as a physician. It's not as if I'm making excuses. If that doctor cannot write for the equipment, assuming he's practicing in the village, there is no CT scan in that village, there is no test he can do, he can't talk to management, they can't change this. He has almost nothing to work with.
That's
What do you
correct.
think he will say? What do you think he will say? He will
I,
encourage you
I
to
will
pray, but I'm not in support to, but just know that
I would rather the doctor says that I do not have the facility to check than tell me to pray.
Yes, that was why I said in every 12 there is always going to be a Judas, and it is you don't see somebody said he reigns everywhere.
Agreed.
He
So,
reigns everywhere. He reigns everywhere. So you can still get some unethical doctors. I saw one, they showed a video about an anesthetist in the US or so that was putting some lignocaine inside the drip, and some people were there, even a doctor even died, a female doctor died. So there's the quackery is everywhere. So there are quacks everywhere. So please, I would like to engage you again so that with this your platform, we can start getting people to really understand how medicine is practiced. It's not to say because Dr. A didn't do well, that's why all doctors are bad. Planes have been just cool down, because that's what we circulate more. Planes have been crashing, true of us, but flight is still the safest means of transport, true of us.
You wouldn't know, but I am number one proponent of science medicine. I'm number one proponent of science and medicine. In fact, I'm against prayer and a native doctor when it comes to science. That does not mean I don't pray. I pray. But when you have a medical issue, please.
We are saying the same thing, man. We are saying the same thing. That the person said it is not a reason why they are not failing. And there is still a place for spiritual healing, for your information. But you shouldn't come from that. You shouldn't come from the doctor. Are you getting the point? Yeah. Thank you, man.
Dr. Duri, I know and I see and I sense and I feel the passion you have. And honestly speaking, that is why you're here, because we need to sensitize the people. And again, I agree with you. The facilities, the system is not up to date of what we want for our medical doctors in Nigeria. And we will continue to shout and cry out to government to build the hospitals in Nigeria rather than going abroad to
not only build, equip, man the hospitals.
Of course.
Employ them and even retrain them.
Correct.
Retrain them, send them for more up-to-date trainings.
Fantastic.
It's not a knee jack, it's a plan, it's a system thing. Thank you.
Thank you. We will continue to do that. And thank you very much. On that note, Dr. Jonathan, you came in between our Nigerian talk. You see, we Nigerians are very passionate about our country, no matter what, and also about what we do, especially the works of our medical practitioner, which three of us here are in the medical field. So thank you very much for Dr. Duru. Dr. Jonathan, first of all, do you want to again introduce yourself? I know I've done that, but you can just quickly introduce yourself. Thank you.
Okay. Hi, can you hear me?
Yes, I can hear you.
Perfect. Dr. Drew, really impressive information. Thanks for sharing, and I'm really glad for the opportunity to listen at Nurse Angel. Thank you. And it's a real honor and a humbling experience to speak here on this platform with so many people visiting. I'm Jonathan Noel. I am originally from and grew up in the Caribbean, in Barbados. I did some training in Trinidad, and a lot of the challenges Dr. Drew alluded to are ones we face as well, in terms of brain drain, we call it, of which I have contributed to. And it is something that I would say weighs on my mind as to how I can give back to my home and others. Things have been done, but we do need people like yourself, Dr. Drew, to confront us and say, what are you doing for your people back home? And I wholeheartedly agree with you, and I'll be reaching out, don't worry. So I think, John, for me, I have come here to speak humbly about prostate cancer in terms of the eyes or the lens of what my practice is at the UK, but it's not lost on me that a
Are
lot.
you going into the talk without me asking you a question?
No, you can ask me whatever you want and interrupt me at any time. That's fine. That's fine. But I trained in here in London for urology, did medical school in the Caribbean. I've been a consultant at Guy's Hospital for 2 years, and I do prostatectomy surgery for cancer, but I also deal with benign prostate enlargement surgery for that as well. Biopsies, but also I enjoy engaging with the community, and that's why I was late to come here, because I was at a Caribbean gathering and they were serving food, and I had to have a plate of food before I left. Otherwise, I would have been looked on as being very rude. And then when the second plate came, I said, well, I'm going to be very late for this event. I have to go. So I ran out the door, and I'm sorry I'm late, but thanks for having me. Ask away.
Thank you. On that note, I want to showcase this, Dr. Jonathan. Based on confidentiality purposes, I will not be mentioning any names.
Yeah.
Dr. Jonathan, I know you know about this picture. It's from you, yeah?
Yes.
Dr. Jonathan, we posted this on our page.
Uh-huh.
We posted this picture on our page, and
Yeah.
we asked our audience to guess what this is. Dr. Jonathan, do you know? Can you guess what they guessed? Don't say what it is yet. Can you guess? What do you think our family members say that this was?
Flower.
Dr. Jonathan, everyone that guessed on that particular post said that that was actually an aloe vera gel.
Well,
It said it's an aloe vera gel. Dr.
okay.
When I saw it, I laughed because I posted that. And can you please explain to the family, the audience, what that is actually about? What is it?
So that is a prostate gland, and what it happens is that we do a lot of scans when we use MRI scan. We're lucky enough to have that.
Dr. Jonathan, you'll be loud and slow when you're talking, so our audience from all over the world can understand.
Sure. So as a prostate gland, we do the MRI scan, and the MRI scan gives us a nice picture, but it also shows any area in the MRI scan of the prostate that is dark and is suspicious for prostate cancer. So through a reconstruction of it on a computer, we can print out the shape of the prostate gland, so it becomes a three-dimensional figure that a patient can have in their hand before they undergo surgery to understand where the cancer exists. You can see that the cancer is represented by that white little thing on the bottom of the screen, by the thumb of that patient. That little white blob there.
Yeah.
And that shows how close it is to what is projected on the back. Those are the nerves. So then patients understand why nerves can be peeled off of the prostate on either side and spared. But when it's so close to that tumor, that little white blob, we have to be very careful that we don't leave the nerves behind and leave the cancer behind. Otherwise, what are we doing here?
So, doctor, you're speaking super. Oh, it's true. That's what our audience are hearing. Again, our wonderful Dr. Duru had already earlier explained that for cancer, the line, there is no much of a border demarcating it. Looking at this, I understand what he's talking about. Can you tell us again, clearly and slowly, where is the cancer, prostate cancer? Where is it? And talk to us, how will it be removed? This is practical example of what Dr. Duru has been saying before you came.
The cancer on this picture
Go on, talk to us.
is the white dot near the man's thumb, bottom of the screen.
So
See that white area? That's where the cancer is. And to remove it,
yeah, like a cover underneath. Is it the one you're talking about?
correct. So to remove the whole prostate gland, you can remove the whole prostate gland,
okay,
but leave the nerves behind on the other side. Can you hear me properly? No.
Absolutely.
And then on the side with the cancer, you peel off a few layers and leave nerves behind on that side. And then that will cause the man to recover with some challenges, such as the erections being a little harder to get back. But if you spare enough nerves, you can get back there with tablets, etc.
So when you say the erection, take time to come back. How long will it take to come back? Is there any time it will not even come back at all?
Great question. If the cancer is caught early, or if the cancer is in the middle of the prostate gland, then we can leave all the nerves and peel them off nicely. So for this particular patient, you can do a full sparing of the nerves on the other side, the top of the picture. Now, the bottom of the picture, you will leave few little nerves. You'll probably leave about half on that side. And then the erections will come back. We would say an average, good is 6 months. Average is about a year. Really, really good is 3 months.
Doctor, the time we spoke here, it was so clear. Now maybe it's your earpiece. It's not so clear anymore. Yes, you're like mumbling. Thank you, sir. You're now muted. Unmute.
All right.
Fantastic. Now we've got you. Doctor, you just reiterated what Dr. Duru said regarding the taking away of the cancer. And also, you said something about 6 months for erection.
For the comeback, yeah. To come back, I always tell my patients, you can't get better than you are before the operation. So if it's a 5 out of 10 before the operation, you can't expect it to come back as 7 out of 10 or 8 out of 10 after the operation. It's not going to happen. Okay? We go back to the baseline where you started.
Oh, okay. Now, doctor, you said something about very, very good 3 months, average 6 months, as average 1 year, and so on. Is there something to do with age factor as well, or just the body of the person? Because we know
age, yes. The younger the patient, the faster it returns. Also, if the patient has lots of other medical trouble, like blood pressure elevated, they're on medication for that. Diabetes, it's not controlled very well. All of these things will impact your ability to recover your erections, because the medication that you're on is counteracting that as well.
All right. So, doctor, we have been with Dr. Duru for a good 1.5 hours. And
very good.
Justice to the general cancer.
Good.
It's we were talking about myself, my breast cancer, this not cancer, yeah, the growth here, the growth there, because we all hear that is a growth, is an abnormal growth. So when we hear of growth, cancer, is it cancer? Is it cancer? That's what we always ask. Doctor, because today we want to focus on prostate cancer, I want to ask you this direct question before I come to Dr. Duru. Dr. Jonathan,
Yes.
now, check done. Cancer confirmed. No more binary growth cyst. Now is confirmed. The patient has cancer. Now, can you guide us through from stage 1 to stage 4? What is the significance about the stages, and what are you expected? And again, maybe you can add this. Is there a time you will say this particular treatment is good for this particular stage? This particular treatment is good for that particular stage in terms of prostate cancer?
Great question. So, stage 1 prostate cancer and stage 2 prostate cancer, confined to the prostate gland. A little bit for stage 1, a lot for stage 2. You can remove the prostate gland with surgery, and then that is a treatment. You can have radiation treatment to the prostate gland also. And you're not put to sleep for that. That's not invasive, but you have to come back for a few sessions, or fractions as they call it, of radiation treatment. Now, stage 3 is when it's spread outside of the gland to lymph node tissues, maybe near the bladder, if it's that advanced, maybe the water pipe, the urethra, if it's that advanced. Surgery to remove that is going to be complicated, probably leaving cancer behind, and you're going to end up having other treatment anyway. Would it be our recommendation to attempt surgery removal when it's spread to all these nearby vital organs? Stage 4, when it's moved beyond your pelvis to your lymph nodes in your tummy and even the lungs and the bones, radiation treatment even isn't enough. Then you're looking at chemotherapy medication. More often than not, with chemotherapy medication, we're actually using novel agents that are new and on the market, and they block your hormone receptor or your androgen receptor. They are new medications that are actually being better than traditional chemotherapy. Very expensive medications, and some of them are not even available on the NHS.
When you say expensive medication, is it tablet? Is it injection? What kind of medication are you talking about?
So the most impressive one that I've come across is an injection called Leuplide, and they give it to you at the time of a scan, and the scan picks up the cancer in different areas, and this agent is injected at the time of the scan and binds to these areas and attacks it. But that is not even available on the NHS for all patients. So patients access that privately if they wish to. That's stage 4 treatments.
Thank you, Dr. Jonathan. Just to ask a follow-up question on my uncle. This is my dad's youngest brother. When he had his cancer, it took a long time. He was a very strong man, very, very strong man. This guy you see on the wheelchair. It took a long time before he went to the hospital. Very, very long time. After trying herbs, trying native doctors, going for a kind of concussions and what have you, thinking somebody bewitched him and other things before we were able to talk him to go into the hospital. And there was a medication I was told to buy. Then I wasn't into I've not studied nursing. And then I bought it. The medication, I can't remember the name, but it was $7,000 for one pack. I paid for it because I thought my uncle's life or nothing. I paid for it. And to be honest, and to look, I paid for this medication, $7,000. We flew back to meet my uncle. When they give him the medication, he can't swallow it. He was in stage 4 prostate cancer. I visited the hospital. Let me show you this again. I visited the hospital. Can you please turn, Joe? Sorry. I visited the hospital. Yeah. I didn't put that picture. In fact, they used syringe. I was watching. They used syringe to pump out blood from his penis. Oh my God, what is happening? They are using syringe to suck out blood. You see the blood, they're sucking blood out. I was like, what's happening? You're talking about medication. Is there a stage you will get to that nothing can, because at that stage?
Yeah, stage 4 is dependent on whether it is responsive to castration, they call it. So castration is removal of your testosterone producing organs, either by surgery, removal of the testicles, or by medication, which blocks the action or the production of testosterone. More often than not, people can give medication now because the surgery removal of testicles is not that, I suppose, palatable to some people, but it is still practice. A family member of mine had that done in the Caribbean and it worked just well for them. The testosterone stopped. But when a disease becomes resistant to castration, that's when things become limited in terms of options. So a medical oncologist who deals with chemotherapy will either keep giving chemotherapy, and then you can put radiation treatment to perhaps the spine, if the spine is involved with the cancer, or the spine looks as though it may be critical to causing that patient to go paralyzed in their legs.
I wanted to say that all of a sudden he became paralyzed. From someone walking, and he used to do a lot of iron bending, and he's now paralyzed. You just mentioned that it could lead to that.
Yeah, it commonly goes to the bone, you see. Commonly goes to the bone. So if it's advanced enough, it can go to the spinal cord, which is in the middle of your spine, protected. But with cancer, it can invade into that. We give radiotherapy in that instance to that area to slow it down. But like all cancers, not special to prostate, all cancers, if there's a stage of disease where it's resistant to medications, then people look towards palliation, they call it, which is medication to keeping them comfortable and preserving their dignity and quality of life. And that's not an easy thing for any family member or patient to go through.
Dr. Jonathan, Dr. Duru, apologies if I remember my uncle. I feel really bad. I want to say that a family member, this for Dr. Duru, a family member, Naomi, Dada, is asking, how can someone know that he or she has cancer? Like signs and symptoms of cancer. Dr. Duru. You're muted, Dr. Duru.
Thank you very much for the question. The signs and symptoms of cancer are usually as limited or directed to the organ of origin of the cancer. For the cancer of the prostate, it is usually with difficulty in urinating. Difficulty. The difficulty could be, Dr. Jonathan will throw more light, could be difficulty in patient has what we call obstructive symptoms or irritative symptoms. If it gets more, or the disease gets more advanced, the person may be passing blood in the urine. With time, if it gets to the spine, person may become paralyzed. If it is the breast, the person will notice a lump in the breast. The breast will get bigger, it may get disfigured. Blood may come out from the nipple. With time, if it goes to the lungs, person may have fast breathing. If it goes to the spine again, person may not be able to move. The same with almost every cancer. Lung cancer, the same thing. Person will be coughing, can cough and cough up blood. If it's cervical cancer, person may start having what we call postcoital bleeding. After sex, there's usually blood after sexual intercourse with the spouse. Some may start having foul smelling discharge from the vagina. Some may start passing urine through the vagina. If it gets more, some may start passing stool through the vagina. It can also continue to get bigger or get more advanced and make the person paralyzed. If it is a bowel cancer, cancer of the colon, person may pass blood in the stool, or it may block the person, and the person may not block the person's ability to go to the toilet. We call it intestinal obstruction. If it is cancer of the stomach, person may have what we call dyspepsia. That's symptoms that look as if the person has ulcer, upper abdominal pain. If the person is not careful, he may be taking drugs for ulcer, and he may be getting some relief. So the person needs to be properly assessed and examined, investigated. One of those tests is endoscopy. Look into the mouth, to the stomach, or look through the anus into the intestine. So the symptoms of cancer are usually related to the organ of the cancer, where it's coming from. But my advice, that is the advice I have advised before, and I keep on saying it. In our parlance, we say, draw your ears and hear it. Don't start interpreting symptoms you have in the body. That is the person's greatest undoing. Once you notice anything, you notice that it's abnormal. This is not the body I had. Go to the doctor. Tell the doctor about the symptoms. He will guide you. You don't need to use pen and write all these 20 or 30 features of cancer. They won't help you. The most important message is how you can be helped, how you can help your daddy or your family relative or your mother. Anything you notice that is not the normal, whether it's a swelling in the body, a discomfort, a pain anywhere, blood in the stool, blood in the urine, anywhere. When cancers become more advanced, people will lose weight and their body will get swollen. But before it gets to that, don't try to interpret the symptoms. So take your symptom, walk with your legs, meet your doctor, discuss that symptom of that part of the body. Allow the doctor, let him have the headache of interpreting the symptom. Thank you.
Thank you very much. Thank you.
Dr. Jonathan can add one or two.
Yeah, he will add one or two. Thank you, Dr. Duru. I want to say this, Dr. Jonathan. I know you came with your slide. We'll put it up shortly, quickly. Dr. Jonathan, I've asked Dr. Duru this, but I'm dying to find out from you as well, as a man, and also as someone that is an expert in prostate cancer, especially using robotics as well. Dr. Jonathan, does too many sex prevent prostate cancer? Because A lot of men go about saying, I need sex, I need sex. If you don't want me to have prostate, give me sex. And apologies, in some cases, you see rape or they take advantage of little children. I've seen one a man that it was televised. Um, it's really disturbing, and he was taking advantage of little children. And he said it's because he's trying to prevent um, prostate. Is it true that having too many sex prevents prostate cancer for men?
Some studies suggest that the more you ejaculate may lower the risk, while others say the contrary. So the jury is out. I don't think there's any strong evidence. Level one, we call it randomized control trial, where you have a group of men who don't do it often and a group of men who do. And then we follow them for 10, 15 years to see and whether they stick to it. It's a very hard study to design. You know, you can't, you'll be following these guys up and hoping they are telling you the truth. In fact, lots of studies like that where people will take it upon themselves to dilute the intention of the study happens, particularly with PSA. We knew that from the prostate, lung, cervix, and ovarian study where they compared people to take PSA regularly and take PSA whenever the spirit called them. And all the people went for PSA, and we have nothing to go by. And the same with ejaculation. But make it clear that if a patient wants to say that they need to do that to prevent cancer, the method of doing that shouldn't be those criminal things that you mentioned. That's a crime, and that's not something that I would ever, advise for a reason to prevent cancer.
Okay, thank you very much. Dr. Jonathan, you gave me a slide tonight, and you said I should bring it up. Do you want to go into the slide, or do you want the interactive session?
I like interaction, unless it's the audience, it's for you all and your audience,
I will say, sir, please do go through your slides.
You can go through them and just take it easy. So this is me and the guy, the guy's hospital is where I work, and the emblem on the right is the University of the West Indies, where I did my medical school. The pelican is a pelican that we see a lot in the Caribbean on the top left of your screen, and the little blue waves of the ocean. So next slide, if that's okay. Are you okay to navigate through that? Good.
Yes, it was really heavy, but I navigated. I'm an engineer myself as well.
Yeah, you could delete it if it's too much data. That's okay. So diet, screening, diagnosis, treatment, and survival is this is a whistle stop kind of talk. If you start talking about prostate cancer, you could be here till tomorrow and still not enough time.
Yeah.
So forgive me if I don't cover every single fine detail, but prostate health is important, and lots of people ask me what can they eat to prevent prostate cancer. Obviously, diets that we like, particularly meat, red meat, is not a good thing. We know that from men from Asia, China, who have a low risk of prostate cancer, and suddenly they make their way to the UK and the United States, and they're enjoying all the red meat, and suddenly their risk of cancers go up. So there is environmental impacts. Dr. Dura alluded to smoking, very important. So lifestyle choices are important. More tomatoes, leafy green vegetables, fish and chicken rather than red meat, processed meat, hamburger, hot dog. These things will cause cancer for you.
Wow.
But they are genetics as well. And, Angelina Jolie was mentioned. She had a genetic abnormality, and because of that, she went forward and had the surgery before it even started to change the organ, the breast. And that same gene is the same for prostate as well. So men, if your sisters, your mother, your aunts have breast cancer, you should be aware that prostate is maybe something that you could get. everybody should know by now, but PSA, but for those who don't, PSA is a prostate-specific antigen, and it's a blood test. It's a blood test, it's a blood test, it's a blood test. It's not a finger examination, it's a blood test. Don't get mixed up between the two. And it can change and increase if you've had recent intercourse or you've recently had traveling, long haul traveling. These things can cause it to go up. And then if that's the case, I always say to repeat it again, because you can get false elevations. And that's been a criticism of using it only to help diagnose prostate conditions. You got to use it with other things. Next slide. We can skip past this one. So prostate cancer is the most common. 20%, 27% of all new cancers in a global study, but it's more common in different parts of the world, as you know. The risk factors are men will get it as they get older. There's no turning away from that. And most people will say you can die with it, not of it. But I think that is something that is being seen as different depending on the patient's family. If I've got a family history and my relatives were diagnosed very young, then you better believe that will impact me in my younger days. 1 in 8 for white men, 1 in 4 for black men, 1 in 12 for Asian men. So you can see that we have to be aware. And Europe have said, go ahead and screen in 2022, but the UK says no screening. Next slide. And you can believe that. UK says no screening, do not screen. Council demand, we do not want to overdiagnose and overtreat too many men. And since the pandemic came, everybody was fearful to come to the hospital. They mistrusted the vaccine and they mistrusted your GP and they mistrusted everyone. So now we're being very proactive. Me and my colleagues in my part of Southeast London, because we have a very rich, diverse cohort of patients, and we've got the high-risk guys. Next slide. Which you can see that despite a lot of randomized controlled trial level 1 evidence, PLCO, ERSPC, these are big studies that showed at first no benefit or little benefit. But what we're seeing is men get the benefit for prostate screening when it's 10 and 15 years. So a life expectancy of a man is important. If the man is sick with other things, lung, heart, 5 years, the best is his projected lifespan. I don't think prostate treatments, etc., are a benefit to him. He will probably have other things that need to be addressed.
So on that note, I want to talk about my dad. Yes, my dad's younger brother died of prostate. My dad was also diagnosed in 2019 or 2020, sometime round about, of prostate cancer. My dad currently is 81, but when he was diagnosed, he was like 76-ish, or thereabout, 76, 77. So immediately, because when my dad's younger brother died of prostate, I took my dad in, we came back here, straight to the hospital. Doctor, diagnose, check my dad. Why? His brother died of cancer. His cousin died of cancer. His this died of cancer. You have to check him. They looked at it and said, why now? I said, just check him. He has family lineage, like I asked Dr. Duru, of prostate cancer. He just killed his brother. Let's do a check. They did. And what happened? They said, he has cancer. What? And we're busy helping his younger brother. Meanwhile, he's also a carrier. Without me taking him straight to the hospital that day, no signs or symptoms. Immediately, they started him with an injection. Then before they sat with me, before the injection, they sat with me and they said to me, that your daddy has cancer. His PSA was 15 or 20-ish. And that blah, 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 blah. The rest is history. Again, I wasn't in the medical line. Then they said to me, like you just said, we'll watch him. I said, what? They said, we'll watch him. I said, God forbid. What do you mean you watch him? It killed his younger brother. You can't watch him. Treat it, take it away. Just take it away. I don't want any cancer in him. said to me, sorry, but he has high blood pressure. He has seizures. He's always having seizures. He has high cholesterol. He has diabetes. He has this. He has that. He has a whole lot of things wrong with him. They said those illnesses will kill him before the cancer. I said no. How are you telling me this? Cancer is a dangerous, terrible disease. It killed his younger brother. Take it away. They said they want to watch it. I say, not under my watch. You can't watch my daddy carry the cancer. You must treat it. And they decided to go give him injection. And they gave him injection. After about 6 months, they tested again. It was about 5. They continued. They placed him on tablet. Then they checked again. Currently, he's 0.90 something. I'm always checking it. Then they said to me, are you happy now? I say, absolutely, yes, thank you. So you just say that some people will watch the cancer depending.
Yeah, watchful waiting.
Yeah, continue.
But it is a balanced discussion, and I think the family has to be involved for sure, because if they feel strongly about things, then hormones are fine. Hormones can sometimes be the injections can sometimes give you lots of side effects as well. Weight gain, your bones health is a bit low down. Your muscles start to get a little weaker. So hormones are good, but they're not a walk in the park sometimes for some patients. But if your relative is tolerating it fine, then that's just fine. And you can go off hormones for a year, come back on, just depending on the situation. So when the pandemic happened, we said, look, we got to be proactive and we got to be opportunistic. So we go into the population and do lots of talks and raise awareness so we can get patients back to the pre-pandemic level of diagnosis, because we track all of our diagnosis. Next slide, please. So you can see the diagnosis drop down like a ton of bricks, 2020, then 2021. Look at the diagnosis. All went negative. Our baseline that we were used to seeing patients presented with prostate cancer suddenly fell because of COVID, like all organs. Next slide. But then all the other organs are recovering. And prostate, which is the broken line on this graph, is not recovering. Men are just fearful to present. And they shouldn't be, because when the PSA is up, we're very lucky in the UK. I know that an MRI scan is not an easy thing to get in other countries. It's very expensive, especially if you give contrast injection. But we've really take the costing right down by doing a quick MRI scan in 15 minutes. And we can find areas in the prostate that we would never find on the finger examination. And so we can be very, very particular as to who we biopsy. Some men don't even need a biopsy. And that's cost saving in itself. If you could do an MRI scan and show that 70% of men have normal or just a big prostate producing the PSA, then you don't need a biopsy. And that would be very good for patients, because they wouldn't want to have a biopsy unless they absolutely needed to. And it seems the MRI is allowing us to find the patients who really need to. Next slide.
Again, on that note, I will say that just like I was battling with Dr. Duru about some factors that affect medical doctors in certain countries as well. And he pointed out that is here. Yes, Dr. Duru, you're right, is here as well. Doctor, just like you said that the treatment option for cancer, some of the powerful ones, is not free it's not available on NHS. So you have to do it privately. I know that's what you mean. I want to say that nonetheless, doctor, just like I said, I had to battle it before they were able to confirm, because they say, go home, you have poo. Go home. I go to the hospital, they say, go home, you have poo. Go home, you have wee. Go home, you have this, until you keep insisting, this is my body, this is, do this test, do this test, do this scan. This is also similar here in UK. Sometimes patients, like have to exaggerate before they are, like you said, MRI. is quite expensive. And sometimes they just stop at the blood test. They say go home. They do blood test. They say go home. You see some people that have seizures, like they'll say go home. We've done examination. Look here, look there, and up and down. Go. When my dad was diagnosed of something I don't want to mention because I didn't take permission from him, I had to insist for there to be an MRI. Yeah. Why is it that sometimes doctors, even here in the UK, you need to exaggerate your case before a higher level scan to interpret what is actually wrong is done? And sometimes when that is done, they actually find the cause or an issue. I give you an example. The patient, which you know yourself, when he was first checked, they say, "Oh, that's fine." I say, "Go back," and he went back here in UK, and they said, "Oh, you have this. Why do you need to? Because we are all medical practitioners. I'm not against us, but let's be honest. Why do you need to insist, in some cases, exaggerate before you're actually giving a higher kind of screening that will detect the actual cause or see something they overlooked at the initial stage?"
Yeah, the first scan is an MRI scan, and the first test is a PSA test. But the GPs, the primary care, are not held to account to offer that. They don't have to. Yeah, and that's what we keep fighting for, is for a screening program, or at least not a blanket screening program. Screen people who are at high risk, family history, 1 in 4 Black men. So this is a population-based screening is important, but smart screening is important. And until that happens, you'll always get people trying to fight with their GPs. And that's why, I do these talks, so that, I can be a source of a referral or a reference, and it can help guide people towards getting the test. So Prostate Cancer UK have a risk checker, and it takes a few questions and then says you're at high risk or you're at low risk, go to your GP. And I think with that and the power of social media and advocates like yourself, we'll be able to get tests. But for most times, doctors want to investigate, but they may be guided by other higher people to not overly use the resources if they are not duty bound to by law to do screening on everybody. I think it's going to change soon because the tide is turning, and more people are coming forward saying, "Look, I'm in my 40s and it's spread. I'm at stage 4. Why are you not testing?"
True.
It's silly.
True, because this has led to a lot of death. And like you just mentioned, a lot of higher stages when it was just overlooked, because they will say nothing is wrong with you.
Yeah.
You don't meet the threshold for you
Yeah.
to be offered this. So it's really terrible. Thank you for pointing that out.
That's all right. So
In
next,
no way is it against our professional colleagues. It's just that we need to also
so in the biopsy done, with the needle through the back passage is still practiced in some countries. That has a high risk of infection and a high risk of coming back into hospital, and men run away from it, rightfully, because it's not comfortable. Now, if you go to the next slide, we don't do this anymore in my hospital. We do what's called through the skin, so it's cleaner, and we don't give antibiotics if the patient is healthy and no diabetes, no sugar. We just put the probe just to see, but the needle goes through the skin and is very well tolerated, and we don't give antibiotics. So imagine, your hospital would love you for not giving antibiotics to every single person, because antibiotics are going to cause any bugs to be resistant and super strong. And we live in a world where you just cannot have that. You just cannot have that. Can't give antibiotics for every single thing. You promote resistance. So you need to promote sensitivity. We're going to the treatment side now. So
hopefully we'll finish in 15 minutes, because we are now over, almost going to 3 hours. Oh my God. Sorry, Dr. Duru.
Lord, that's fine. My battery about to go down to 2% in Yang says so. They'll charge it. Active surveillance for low risk cancer, Gleason's 6 prostate cancer, they call it low risk. Okay, and you just watch it, and if it doesn't progress, and some people are happy with that, they don't need the treatment. Some people get very nervous and anxious and they want it out. But in the UK, we really push for that. And these are studies from big hospitals that you may have heard of: Memorial Sloan Kettering, John Hopkins. They looked at all of their patients and they found that the risk of cancer and death is less than 1% for people on surveillance, which is good odds when you look at the thousands of men. But we do surgery. I think open surgery to remove the prostate versus robotic surgery is the same. It doesn't matter about the tool, it's about the surgeon and how they use their hands and how they manipulate themselves to do a good job. I use robotics because that's what I was trained on. I use robotics because it means that you don't even have to worry about a blood transfusion. And I use robotics because you get home the next day to your family. And I think it's the
So
future.
talk more about the robotics, because there's like, the current slangs here in UK. The robots are coming. The robots are coming. They're taking away jobs. And you see that when you look, the robots are not taking away jobs. They're actually enhancing jobs. What do you have to say about that?
Yeah, I think the robot is not taking away jobs as long as we maintain control and we're not switching it on and walking away and having a cup of coffee. I have complete control all the time. It can't be worked on without me. What it does is it generates new jobs, new interests for people because they can actually see for the first time a surgery on a screen. They can record it. There's lots of stuff you can do on it because it's a computer allowing you to do the surgery. Um, I experimented a lot with switching on the robot computers to see blood flow through the nerves so that I was sparing. So I knew that man had a good function for erections after. This stuff you just won't be able to do with traditional open surgery. I'm not saying that open surgery is not a good operation if done well. It is a good operation. I know that. But I know that I can do a better job with the robot because
And
that's been
and
proven,
that one at
and
that.
I can be as good as someone who's been 20, 30 years in the game doing open surgery. So why not allow us to progress? But it's the cost. It's an expensive adventure. I know that. And then radiotherapy. Radiotherapy is good too, but the robot looks like that. Okay. It's just the left two pictures. That's me using the robot. You can click on the video there on me.
Let me see. And you?
Maybe not.
It
Not
won't
gonna
allow
work.
me to click. So sorry.
It's okay. That's okay. And
Make
then
it.
this is the study here that shows robot versus open. The same urinary function, sexual function, no difference. Okay. So but the two surgeons that compared each other, one was a guy 30 years in the business doing open, the other was a guy who was 5 years a surgeon doing robotic, and they had the same outcomes. So tell me, although it's not different, it is different for the surgeon and the experience. Robot, sorry, prostate cancer can sometimes be just one little area on the prostate, not much. And now people are asking for just freeze this one section for me, doctor. Focal therapy it, doctor. Just leave it, just freeze it and watch it, doctor. And just let the cancer, if it come back, it come back because it comes back about 33% of the time. So if 1 in 3 you're happy for it to come back and you prioritize your function, your erections and continence over the cancer control, then I think it's appropriate to do focal therapy first. But if it fails, my friend, we have to do the whole gland, okay? But it is something that I would speak to if you have questions about.
Yes. So again, like you said, most men, when they are told they have cancer, they run. Prostate cancer, they think of their equipment in terms of the functionality of it. And they run and run and run and run. And in the end, when they come, it's not because they want to come. Maybe they see blood all the time, they have pains. Meanwhile, when they found that they had it, they ran. Just like you're talking about the function. So, what do you have to say to men that have the early diagnosis of prostate, what is the best option? Are they to consider that their sexual intercourse as against and treatment of the prostate cancer?
I think it's a very individual approach. I think early stage, low risk, you should just survey and then they can enjoy. I think it's early stage and it's in the middle, then there's an argument for just treating it and closing that chapter and moving on with your life. But if it's one tiny area that's involved and the rest we've biopsied and it's clear, then focal therapy might be the middle ground. But I've had some patients say, look, just take it out, doc, ready to go. I had some patients say, look, I don't want to hear about no surgery. Leave me alone. But it's an interesting space, and I don't think we will find the answer tonight for sure.
Yes, and on that note, I want to say that most of our viewers are in different countries that have later time than UK.
Yes, I see that. They're not sleeping on the call, no? Okay.
Isn't it, Jessica?
Tomorrow is work day, early to bed. All right.
Yeah, so because it's almost bedtime in the country.
Yes, mine too.
I know next week is your anniversary.
Yes, praise God. Yes.
Is it okay for you to come back sometime so we can fit, because this slide is very important?
That's fine.
Yeah, is it okay for you to come back at another time?
Yeah, no problem.
But before I let you go, I want to say to you, you started with statistics. What do you have to say to all men? Then I asked Dr. Duru his closing remark. Then please, one thing we do, which I didn't tell you, is that we dance. And because the family wants to see you dance and Dr. Duru dance. Dr. Duru, I beat him in the first opening dance. But now we'll try the three of us, and I'll show you that whatever man can do, a woman can do better. So what do you have to say to men? That are a lot of men listening to this program and not saying anything, and they're also worried. What do you have to say to them?
I think they need to find a confidant, somebody who may have been to the journey already, another man. There's lots of support groups out there. Doesn't mean you have to go there because you have cancer. Sometimes you just sit down and listen, and suddenly you feel compelled to open up. Going to doctors is daunting and scary. I know that, which is why I come on these programs, because hopefully, people will feel a little more relaxed to come and open up about their concerns. But you got to talk. You got to ask questions. If you do nothing, then nothing will be done. And just know your PSA. You got to know it. What you do with it is fine, but just you got to know it. You can't not know it.
Fantastic. Thank you very much, Dr. Jonathan. There is a lot of responses, but let me ask Dr. Duru. Dr. Duru, thank you for having started with us. Thank you for all you have said and contributed. But Dr. Duru, just like Dr. Jonathan is advising men to find a confidant, I must say to you, Dr. Duru, that even with a confidant, men, when they hear that they have prostate cancer, their confidence go down like boom, as if they are, I'm sorry, I'm not a man, so I may use the wrong word, but correct me, as if their life depends on that. For me, I would think, as a non-man, I would think that if I have an option of treatment and sex, I'll take treatment than sex. But I'm not a man. I don't have the ability to speak for the man. Dr. Duru, again, why is it that men run and run even when they discover they have prostate cancer? And what do you want to say to them? You're muted.
Thank you very much, Nurse Angel. I don't think that men want to run away when they discover they have cancer. The only thing is the news or the diagnosis of cancer for every individual is always a big issue. It's not just because men want to run away when they have prostate cancer. We have seen women that run away when we told them about breast cancer and they come down with
1 minute, sir. 1 minute. Tonight we'll talk a lot of parts on other cancer like the
okay, no one. So for the prostate, so whenever the cancer diagnosis is made and the news is broken to the patient, it's always a big issue for the patient, even for the spouse, the wife, even for their kids. So what I advise is we, being the healthcare workers, should find the best place, condition, environment to break the news. That breaking the news is one of the most important things. It's called counseling. So by the time the patient has good support, family support, clinical psychology support, and every other stakeholder in the family or stakeholder to that person, it will be easy for the person to take the diagnosis and now ask her about treatment options. If it is done in a careless manner, assuming the surgeon or the doctor was too fast, or he had other patients to attend to and he didn't make out time to get this patient to understand and accept the diagnosis, that's when you see the issue of running away in quotes or calls. But assuming you make out time to give your patient that information in the manner, in the language the patient can understand and help you take the decision, because you as a physician, you're supposed to guide the patient, take the decision, and you are supposed to guide the patient, take that right decision, because you understand this pathology, you understand the staging, you understand the prognosis, so you are supposed to guide. And if you do it well, I bet you the patients will not run away. Most men will value their life, put their life first before their sex life or their ability to have intercourse. Thank you.
Fantastic. Dr. Jonathan, I know I said that was the last, but with what he said, is there anything in place, just like he's saying, for men undergoing prostate cancer? Is there anything like support therapy?
Yeah. There's lots. I think it depends on where you live in London. I'm familiar with South London. So many, community organizations for prostate cancer support groups. Our hospital that guys run a brother to brother, man to man organization. So that is what I would say. And they're easily directed, and your nurse specialist should be able to guide you. Is she gone?
I don't know, but she may come back. Jonathan,
Yes,
Jonathan,
Doctor.
maybe I will get your contact from her. I will,
Yes, anytime, of course. Yeah, it'd be good to talk.
reach
And
you.
yeah,
Yeah.
it'd be good. Yeah.
Thank you.
Anytime.
Thank you. Thanks for your time and coming
I
around.
saw your website, very impressive.
After we can discuss on maybe a collaboration.
Yes,
Okay.
yeah. I'd like that. That'd be cool. I have yet to come over there to Nigeria. I've been to Senegal and Ghana, but not Nigeria.
Okay. We can't have her. I don't think if we are free to go. Because she brought us in.
So,
Okay, she's
yeah, I'm back. So on that note, we have to close. This is the longest we've ever had. And for a good reason, because it's a very important topic. So we need to dance. Dr. Jonathan.
Yes.
Please stand up and show what you're made of. You're made of in terms of your dancing skills.
What's the music?
Yes, please stand up for the dance.
I've done my own.
It's winning. Stand up. I'm just saying well done to you. Stand up, please.
You know, I've done the first part.
Oh, na, 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 yeah, yeah. Oh, na, 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 yeah. I feel that on top your mother. Baby girl, God bless your mother. You took my past, mommy, mother. Baby, bless your mother. Baby girl, God bless your father. I feel that on top your mother. Baby girl, God bless your mother. You took my past, mommy, mother.
Make I rest though. And I'm
I have
into.
to go now.
Love you, baby. Kiss me, make I kiss you, baby. My baby, baby, let me love you, baby. Baby, kiss me, baby, make I kiss you, baby. Baby. Baby girl, you mesmerize me. I've been searching, and finally found in love. Yeah, baby girl, you take my heart away. I've been looking, and finally found in love. And I kiss with you, baby. I go school for Germany. I find peace with you, baby. And I never leave you, my lady. I wanna please you, my baby. Are you everything to me? I'm gonna bring your car from Germany. I'll give you mansion and money. Yeah. Make you give me value. I will give you love, and I promise to give you value. I see that on top your mother, baby, God bless your mother. You took my past, mommy, water. Baby, bless your mother. Baby, God bless your father. I see that on top your mother. Baby, God bless your mother. You took my past, mommy, water. Baby, bless your mother. Baby, God bless your father. Love me, make I love you, baby. Kiss me, make I kiss you, baby. My baby, let me love you, baby. Baby, kiss me, baby, make I kiss you, baby. Lisa, Lisa, baby, I beg you, know they play me like that. Lisa, Mona Lisa, baby, I beg you, know they play me like that. Hey, love, baby, you make you give me menu, baby, I will give you love, and I promise to give you menu, baby, love, give me menu, I will give you love, and I promise to give you menu, I see that on top your mother, baby, God bless your mother. No. You took my past, mommy, water. Baby, bless your mother. Baby, God bless your father. I see that on top your mother. Baby, God bless your mother. You took my past, mommy, water. Baby, bless your mother. Baby, God bless your father. Love me, make I love you, baby. Kiss me, make I kiss you, baby. Baby, let me love you, baby. Baby, kiss me, baby, make I kiss you, baby.
Wow. Yes, Jane I is dancing. Christopher, Dr. Jonathan, don't carry me go. And yes, and Zitis is still dancing. Ezine, I thought you said you're sleeping, you're not dancing. Okay. Chi chai, Nurse Angel, go don't tire for waiting. I never tire. Maybe you are the one that is tired. In our mind, is always in my mind. And your destiny is definitely in your hands. I hope you guys learned a lot tonight. Cancer is a very, very terrible disease, and it's a good thing. It's a good thing that there are lots of research on cancer, and there are many, many treatments planned. So remember, if you have taken nothing home tonight by our wonderful speakers, I would say please go to your doctor whenever you feel there is anything wrong with you. Go to your doctor. Like Dr. Duru said, don't go to a friend or go for prayers. There are times for those. Just go to the doctor. Thank you very much. Thank you for coming, and we'll see you again next week. Bye bye. Bye. Bye bye.